Hello and welcome to Badger Talks Live, which brings exciting happenings, resources, and talent from your UW flagship campus to the people of Wisconsin and beyond. I am Anthony Ruiz, a senior studying sociology with a concentration in analysis and research. I'm originally from Greenfield, Wisconsin. Badger Talks Live is continuing its focus this month on public service organizations housed in the UW School of Human Ecology. Covering Wisconsin, the state's federally licensed and certified health insurance Navigator agency is another one of these important organizations. It is my pleasure to introduce Allison Espeseth, Director of Covering Wisconsin. Today, Allison will be sharing about how this program provides free and impartial year-round assistance to help Wisconsin residents enroll in, use, and understand their health coverage to access care. The aim is to improve financial well-being and health outcomes for Wisconsinites, with an emphasis on communities most at risk for lacking coverage and access to a medical home. Allison earned a Bachelor of Science degree in Sociology and Anthropology from Oberlin College. She subsequently earned a Master of Science degree in Consumer Behavior and Family Economics from the University of Wisconsin-Madison School of Human Ecology. This is where her studies and thesis explored the impact of variation in administrative policy on enrollment in state Medicaid and CHIP health coverage among children. Allison will be answering questions at the end of her presentation, but feel free to post them in the chat at any point. Please welcome Allison Espeseth.
Thank you so much, Anthony. So Anthony is our student at Covering Wisconsin. He's been working with us for the past year, and he is a senior. He's going to be graduating this spring, so we're going to be sad to see him go, but thank you again. I'm Allison Espeseth. I'm the Director of Covering Wisconsin. I'm so happy to be here today and share more about this program and really how we can help you. So let's get started. I start with this because if you take away nothing else and really just want to drive home this message that Covering Wisconsin in particular can provide everyone in the state free and unbiased help with health insurance. And so this is we run the gamut from just knowing what your options are and choosing plans, figuring out what's the most affordable plan for your situation, but also that post-enrollment help, understanding how you use your coverage, and also renewing coverage. For some, that's going to be a very active process. Others, that might be something that you don't necessarily need to be as involved in. But again, just understanding what is your situation and what do you need to do. So before I even say a little bit more about Covering Wisconsin ourselves and a little bit of that context, I want to talk about why do we even care about health insurance? Why are we even existing? I probably don't need to explain it too much, but it is important background that health insurance is it's so critical to financial and physical, mental, your well-being overall. There's a wealth of research that has been done over many years, looking at a whole wide variety of conditions, situations, populations, that has time and again shown that health insurance is a key component to encouraging increased access to care, improved health outcomes, and reduced financial strain. We know that health care can be expensive in this country. We know that at times you don't know when you're going to be sick. In fact, most of the time we don't know when we're going to be sick. It helps to smooth out those rough edges, both financially and in your health and well-being. So one example is preventive care. And I want to touch on this because it is important. We often do think about health insurance coming into play when you have a sudden medical condition, something unexpected, something very expensive, maybe an injury. But preventive care is really a core component of why health insurance is important. It can help you to prevent things from happening down the road. It can help you stay well so that if something does happen down the road, maybe it's not as acute or serious. Preventive care also can help give you support for things that you might be struggling with, quitting smoking, mental or substance abuse, and even just covering things like prescription drugs, birth control, that kind of thing. I shared this and include this partly because I just love it so much. This is from a recent book called Health and Wealth, A Graphic Guide to the U.S. Healthcare System. It's by the Center of Cartoon Studies. They published it just last year. Check it out. It's a whole, I have no part in it, but it's really interesting. And again, it's kind of a graphic depiction, visual depiction of the healthcare system. And, our healthcare system is big and complicated. And this particular depiction is imagining it as multiple different games, board games, and they're pieced together, and you might have rules that apply to one, but then as you move into another part of the game, it's totally different rules, or maybe some rules apply, but some don't. And then you move into another one, and it's not even entirely clear how you move from one to the other. Health insurance is kind of like that too. Health insurance is part of that. It's one piece of this game. Maybe I shouldn't call it a game, but it is part of this whole system and this whole thing that you have to navigate. And it's in and of itself could probably be depicted in much the same way. It's complicated. Health insurance has terminology that we don't often use in other parts of our life. Lots of different meanings that we may not understand. There's lots of costs that are involved. Those costs have unique terminology. Rules that can change at times, benefits that might change. Again, I probably don't necessarily need to explain all of this. I think if you have engaged with the US healthcare system, you have experienced this. And health insurance is not something that we necessarily think about all the time. In fact, most of us don't. You think about it when the moment arises, when you're sick, when you actually engage with a doctor's office or need the prescription drugs. So when you compound all of that in that moment where you're feeling nervous or worried, it can heighten your inability to really fully comprehend what it is that you need to do and what's expected. So given all of that, it's not surprising that we would all be challenged to pick an option or pick a plan or understand what benefits are available and could really be useful at a moment. And then, like I mentioned before, even just miss opportunities, knowing that you need to renew, knowing that you need to update your information. So you're not alone in this feeling. I'm really trying to drive this home. I think that's really important to know that if you're feeling overwhelmed by health insurance, that's not unique. It's quite common. And, if anything, we want to make sure that's not why you're avoiding or why any one of us might avoid engaging with this. This slide shows some results of a recent study done by the Kaiser Family Foundation. It was done in 2020. And they were asking respondents, they show them these different reasons or parts of the process of finding coverage, getting it, signing up for it, using it, and ask them which of them that they found difficult. So you see the results here. And one of the most common was just, again, comparing cost. How do you understand from one to the next, especially, again, when these terms are confusing and you may not even understand how to compare them one to the next. And then, of course, slightly over half said all of them, any of them were difficult. And, the above slides, the ones I just went through, those are thinking about folks that are engaging with trying to figure out their health coverage. It's important to also think about there's, as recently as 2020, according to the current population survey, there was 280,000 plus estimated uninsured residents in Wisconsin. So these are folks that either haven't tried, maybe are newly uninsured, don't understand what their options are, or maybe they have. Maybe they have tried, and the challenges, the difficulties were a little bit too much. They were barriers to even engaging in the system. But it's really critical to know that the vast, vast majority of these folks, of those of you who may be uninsured, would qualify for coverage, either through Medicaid or BadgerCare or financial help through the healthcare.gov marketplace. And I'll talk a little bit about what those are in a little bit. So that's where Covering Wisconsin comes in. I've gone over the challenges that we face with health insurance. I've gone over why it's important. And Covering Wisconsin is really a resource. It's a free resource in the state that is intended for anybody in Wisconsin to help them overcome those barriers. So really helping going from point A of having coverage but not understanding it, or having questions about it, or maybe not having coverage at all, to point B of successfully getting connected and enrolled. So we're not for profit, we are free. We work year round, and we provide service for the entire state. And that service is either over the phone or in person. During the pandemic, we primarily focused on phone service, as many resources did. But now we are moving towards providing in-person services once again. So Covering Wisconsin is based at the University of Wisconsin in Madison, and we are within the School of Human Ecology. So we began back in 2003. And so we're getting close to 20 years old now, which is fantastic. Our funding primarily comes from grants, contracts, some contributions, and largely is through federal, state, and local government. We do have other public entities that provide grants or contracts as well. And one of the most important things to know about us, and a term that you'll hear me reference throughout the rest of this presentation, is that we are a health insurance navigator entity. So this is a very specific thing. It is, we go through a process on a regular basis. We apply. It's a competitive process through through the federal government. And upon being successfully awarded, we then have to have our staff go through both federal training and certification. So that goes through training and then have to pass certification. And then in Wisconsin, similarly, extensive training and licensing. And then each year, our staff further have to do continuing education to make sure they stay up to date on that licensing. So it's a pretty intensive process, but important. We have a statewide reach. So we are based in Madison, our home base out of the University of Wisconsin, but we have just deep, it's very important for us to have statewide reach and have navigators that are based throughout different regions and communities and know the different areas of the state and have familiarity with it. Some of the navigators are through directly Covering Wisconsin as our staff. And then we also contract with 10 community serving agencies throughout the state to have navigators housed with them. So it is important for me to share with you what those agencies are. Some of these may be familiar to you. You may be in communities where these serve, or they may not be, and they'll be new to you if you do reach out. One of the reasons it's important that that you know these names and that you're familiar with them, that they're connected with us, is that if you were to reach out looking for a navigator, you may end up working with somebody that's housed within these programs. It's important to know that, yes, they are a navigator as well. They may not have Covering Wisconsin as the name, but they are affiliates with us. So let's talk a little bit about the Navigator role. I've already talked broadly about the Covering Wisconsin mission and goals. Specific navigators also, like I said, they get training and licensing, and then year round, their primary goal is to answer questions from consumers like yourself, from the public throughout Wisconsin. And that's really where it starts. It starts with a question, whether it's a question about what are my options, or whether it's a question about I have coverage, I just can't afford it, or I want to know if there's something more affordable. Or maybe am I eligible for more financial help? Navigators will help you understand those options. And primarily, they help with enrollment in healthcare.gov or the marketplace, BadgerCare Plus, or Medicaid. And I'll talk a little bit about those next. They will also help to determine, like I said, whether you have additional financial help available. And sometimes that even means helping to find community programs that might additionally help pay for insurance or medical care. And like I said, also that post-enrollment help on the back end, even after you have coverage, you may still encounter problems or questions. And navigators are very good about that holistic, looking at the big picture, not just, okay, you have coverage and now you're done. No, we want to make sure you can actually use that coverage to get that care, to get that increased access to health care services. So I'm going to give you a very, very high-level overview of these two programs, but I did think it was important to just touch on the high-level basics of both BadgerCare and healthcare.gov. So BadgerCare is the state of Wisconsin Medicaid program. You see the picture of the card here, Forward Health. Sometimes people refer to it as Forward Health. That's the card that you would receive if you were enrolled in that program. And it's sign up anytime. I'll go into a little bit more detail next. And then healthcare.gov is the other program that navigators primarily enroll people in when they're eligible. And this may also be known as the marketplace, health insurance marketplace, sometimes Affordable Care Act. That's the law that the marketplace first started under, ACA, the acronym. So these are just some of the words you might hear, all meaning the same thing. So BadgerCare Plus, Wisconsin's Medicaid, this has been around a long time. And it's really, there's a Medicaid program in every state. And it's comprehensive health coverage. Really, really important to know that. It's low cost or free. And on the right-hand side, you'll see the income ranges that would qualify somebody based on their household size and their particular situation. It's important to know that this is available for children, families, parents, individuals, adults without children, pregnant women. You will notice that children and pregnant women are eligible at a slightly higher income than men or women alone. And so you may very well see, and we often do see situations where a household may have children who are eligible and are enrolled in BadgerCare, whereas the parents or adults are in, say, something like Marketplace or another coverage. One other thing I wanted to mention here as we're talking about BadgerCare is if you currently have BadgerCare Medicaid, or maybe you know somebody who has that program, we are currently in a unique situation where ever since March of 2020, so that's right when the COVID-19 pandemic officially began, people enrolled in that program have stayed enrolled. So that's unique. Typically, there is an annual renewal. So I say this only as just a little bit of an awareness. Nothing has changed as of right now. But if you or somebody you know is enrolled in that program, just pay attention. Please do check your mail and look for any changes in the future. If any kind of move has happened since that time, meaning moving to a different place, different address, make sure you update that information so that you're getting that mail. and the health insurance marketplace, so healthcare.gov. This is newer than Medicaid, and it's intended to build off of that foundation of the Medicaid program so that a much wider variety in income ranges of residents have access to health coverage. So, and especially outside of a job. Financial help is based on income, and really important to know also because of the ongoing COVID-19 pandemic, there's a lot more financial help available than has ever been available before. Really can change the situation for people. If you've already looked at healthcare.gov for coverage in the past, it might be time to look again. One thing I don't think, well, I did mention, I think, that Medicaid and BadgerCare, you can sign up at any time in the year, you can apply to see if you're eligible. The marketplace is a little different. It has a shorter time frame when most people can sign up. That time frame is November 1st through January 15th, and that's called open enrollment. That said, if something has changed in your home situation, it might be worth talking to a navigator just to be sure. Navigators have a wealth of information and knowledge and are very focused on understanding what options are throughout the year for somebody and what those changes might be that will allow them to sign up for coverage. So definitely loss of coverage through your job, definitely. And there's others. So be aware, just because they're that open enrollment period, and that's an important one, be aware there might be other opportunities. So similar to talking about how we work with other agencies in the state to house and support navigators so that they are more locally available in different regions, we work with a lot of different partners and agencies, way more than I'm showing on this slide. These are some important ones for sure, and I did want to name them. So Wisconsin Department of Health Services, Wisconsin Office of the Commissioner of Insurance, Federal Centers for Medicare and Medicaid Services. They actually oversee and run the Health Insurance Navigator program. And of course, community health centers, health insurance plans. These groups we stay in very close contact with. We work with them on a variety of levels to make sure we understand what their perspectives are, what their policies are, especially if we have questions, that we have a good contact with them and we can have good communication. So if you come to us with a question, if it's not something we immediately can answer, then we have a contact and we can reach out to them. But part of our purpose is also to get that information ahead of time so that when we respond to you, we know it. So the other piece that navigators do that's perhaps a little bit unusual or not expected is not just responding to your questions and waiting for your calls, meeting you for appointments, but it's also to do that proactive education and awareness raising. It is part of our goal to help people know that these options are available, whether we help them or whether they decide to sign up on their own. It's part of our role to spread the word and get awareness out there. It's interesting that the Affordable Care Act, the marketplace, healthcare.gov, this has been around since 2014, and awareness of it is still not super high. Part of that is because if you don't ever need, you have coverage through another means, you may not be attending to it. You may not be aware of it. However, we know that people are becoming uninsured all the time through loss of job or other circumstances. So our role in helping to continue to just make people aware is important. Part of this is also creating what we call how-to sheets. And I wanted to mention that we put such a great emphasis on really understanding what are the questions that consumers have, that as we create these sheets, we work directly with the community, not only to get the questions and their perspective of what those questions are, and so that we can directly answer that specific question, but also to make sure that when we create resources and education, it's understandable. It's answering that question for them. And finally, we also do trainings for other professionals. So these may be professionals who work in health insurance. It may also be professionals who are simply a resource in the community. So I think at this point, it's probably fair to say or assume that you're wondering, okay, so there's your navigators. How do I even connect with you? How do I find you? There's two primary ways. One is online through our website. So that's www.coveringwi.org/enroll. And I'll show you that in just a minute. But the other is just to give us a call. And I've put our phone numbers here. So 2 phone numbers. Again, if you call either of those numbers, you will, the person on the other end of the line will learn a little bit more about you, learn your situation, your story, and also connect you with somebody really local, a navigator local to your area. The other place that I list on here is 211. So if you're not familiar with 211, it's the United Way of Wisconsin resource. It's a helpline. So just like you would call 911 to get emergency help, you call 211, and it connects you to United Way resource specialists, and they help with a lot more than just health insurance. And when I say they help with health insurance, they are not a navigator, they are not doing the help, but they are connecting you to a navigator. But like I said, they also connect with lots of other resources. It's a really good number to know if you ever need any kind of community supports. I wanted to also mention that when you call 211 or you go online, there are more than just navigators listed there. There are other trained and licensed enrollment assisters. I'm just going to mention them. They're called certified application counselors. There are agents and brokers. All are included on there and on purpose, that these are all enrollment assisters that can help you. Just wanted to mention that in case that's something that came up. So I think one of the best ways to just get a feel for this is to show you directly on our website. So we're going to go on a quick tour. So this is our homepage, coveringwi.org. And there's lots of resources here, and definitely encourage you to take a look. We are going to go over here to the left-hand side where it says enroll, and I'll click on that. And what I've brought you to is what we call our connector tool. So if you know that you want to get connected to a navigator or another health insurance enrollment assister, it's pretty simple. All you do is put your zip code in this box, and then you can decide whether you want a distance that's greater or less than 25 miles away. There are language options as well. You can decide if you want to just leave the types of appointments. You can leave them as is, or you can say, I only want in person or telephone or a video option. And I'm going to type in, oops, I'm not sure if it's going to help me today. Okay, well, looks like it's going to just leave it at that. Oh, here we go. Let's try this one more time. Nope, it's deciding to be a little stubborn today. You can type in your zip code. It brings up options for you. One of the nice things about it is that there's also an option to schedule online. Not all options have that. Some resources, there'll be a phone number and you can call that phone number. Others will directly show you days and times that are available, and you can directly pick one and actually put in your information and you're done. And of course, at the top here, there is information about what to bring to your appointment, how to use the connector tool if you just want a little bit more information, and then what is a navigator. And these phone numbers up here are just those same Covering Wisconsin phone numbers that I mentioned earlier. I wanted to also show you, let's say you're not quite sure if you're ready to talk to somebody and have an appointment, but you're curious about what you might be eligible for. We have at the top banner of every page of our website something we call our 2-minute tool or 2-minute screener. If you click on that, it will bring you to this eligibility tool and just says, find out what you're eligible for. It's very high level. It's not definitive, but it may give you a little bit of a sense. So let's get started and see if it's going to respond. Okay. So the very first question you get is the number of people in your household. So let's pick 4. And it's thinking. Let's try that again. Not sure it's going to do it. So you pick 4, and then it will then bring up the next question, which is ask you about your best guess of your income before taxes. I'm going to give it one more try, see if it's happy. Nope, not happy. All right, so then I am going to see if I can get out of this. And what's nice about that is at the end, after you've gone through the different, just those 2 questions, so household size and your general income, it brings up what you may be eligible for. Again, may, just giving you an idea. And then the next step is you can learn more. And in the options that appear after that, there's an option to either go directly to a website to apply. So if I were eligible for BadgerCare, if that's what it suggested, it would give me the direct link to that website. It also gives you the option to go back to the connector tool and say, you know what, I just want to talk to somebody. There's other things in my situation that I'm not sure about, and I wasn't quite sure how to answer this question. And so it's nice that it gives that direct link back to that. I'm going to show you also, this is a really important tool, or tab on our website. Lots of information here. I'll mention at the bottom, there is information if you or somebody you know is an immigrant, that can come into play for sure on coverage eligibility. I would encourage you to take a look at that. In that page also, there is a tool similar to this screener tool, asks a series of questions completely anonymously, and I'll give you a better sense of the kinds of not only coverage, but public programs you might be able to access safely. And then finally, I wanted to mention these how-to sheets. I had mentioned them earlier in the talk that we create these, and these are really intended for you. So I'm going to click on this, and it brings me to this page. There's a lot of resources here. We have many, and we've divided them up into different categories. So we have BadgerCare, Marketplace, but then there's other categories in case those are more of interest. So on this particular page that it brings you to, it shows how to sign up for health insurance, different resources that are related to that. And one that's often very of interest is this one called Options for You and Your Family. I'm not going to try to click on it. I've had a little bit of slowness with my internet today, so we're just going to leave it. But this is a really nice one, and it'll give you a sense that for all of these resources, not only do we try to answer the questions that are of interest to you and others, but then we provide the information in a very action-oriented, stepwise fashion. So the options for you and the family, instead of just telling you, here are all the different options, we say, we're going to start with this option and ask you a yes and no question. And depending on how you answer that, you then may go down to the next option, or it may direct you elsewhere. I encourage you to take a look at those as well. They're all available in Spanish. And like I said, you can look at different categories at the top here. So I'm going to go back to the presentation and just provide a few highlights. I mentioned these throughout, but I wanted to highlight them again. Healthcare.gov open enrollment, it's that November 1st through January 15th timeframe. Really important, I did mention, BadgerCare, you can apply any time of year to see if you're eligible. That's still true. Open enrollment seems to be that key moment. It's like if you miss all the other times, remember that open enrollment. Consumers can get more financial help than ever before this year. Really big moment. If you've already looked, look again. That public health emergency declaration, again, if you or somebody you know has BadgerCare Plus or Medicaid, pay attention to your mail coming up. I should always pay attention to your mail. But these things might be changing coming up, and renewals and redeterminations might be happening again pretty soon in the coming year. And for BadgerCare and Medicaid, that's an active process. It's something that you need to actually take action on. Otherwise, you might lose your coverage. And there are actually more health insurance enrollment assisters available than ever. This has been a growth year, and really important moment for that to help support you in all these different changes and the changes that are coming in the months ahead. So overall, you don't have to be an expert. It's a lot. It's a lot to understand, which is why we're here. So we are here to help, and we encourage you to take a look at the information we provide and reach out to us. Our contact information is there, and I really thank you for your attention and joining today. And I look forward to any questions.
Allison, thank you so much for sharing all of that important information with us. And it's a little bit of a hidden secret, I think, in Wisconsin, that this awesome resource is available. And I know you all are doing everything you can. It's just a big mountain to climb covering the whole state, right? And, I'm sure everybody's touched by someone that has someone looking for healthcare, not sure how to navigate. So thanks so much for all of this information. Hello, everyone. Fran Paleo-Moyer, Badger Talks Live. We're talking with Allison Espeseth, who's the director of Covering Wisconsin. And we're talking about health insurance and navigating that whole lots of information there. So feel free to post questions in the chat. We have had some basic questions, but you've already answered them in your presentation. So thank you for that. A couple of clarifications. So there's two different basic programs that we were talking about. And what was a little bit confusing is that there's Medicare, which is also called BadgerCare Plus, which is also called Forward Health, right? So it seems like everything has like three names to it. So there's this one, pocket of programming. And then there's, oh, please.
Yeah, and I was just going to cut in there. So Medicare is actually different. So Medicare is for older populations. So Medicaid is the same as BadgerCare in Wisconsin. But you're right that, and one of the reasons we don't aim to confuse, but we also want to acknowledge, like, people think about it at different names, and that Forward Health, because people get the Forward Health card, they think I have Forward Health. It's the same as BadgerCare. It's the same as Medicaid.
Yeah. And thank you. I think you're actually a clarifying point, not confusing people, because I think no one else explains it the way you've explained it. So I think that's excellent. So just trying to kind of recap that and let me know if I'm doing so incorrectly. And then the other one is the health insurance marketplace, which is healthcare.gov. Is that right? And
that's right. That's right.
Two different reference points. So just wanted to clarify that for people. So now you have 26 navigators and 10 community agencies. So does that mean if I live in Rhinelander, for example, I'm going to be able to use your tool or make a call, and I will have someone like within 25 miles likely, or does that vary for people depending on where they are in the state?
Yeah, it does vary. The way that we have worked with our navigators and the agencies around the state is that each of the navigators has a scope, kind of a geographic scope that they definitely are going to support. And of course, there's overlap, and really any navigator can help anybody, regardless of where you're located. I mean, the policies are all the same. It's more about understanding perhaps So for example, when somebody is looking for coverage, for sure, the provider network will come in, could come into play for them. And so somebody who's a little bit more local, who is tasked with understanding that region, they might understand that a little bit better. But again, any navigator can help for sure.
Okay, great. That's wonderful. We have a question from William Schmitz posted in the chat. Why are people at 62, meaning age 62, not eligible?
So 62, they are eligible. So I guess I would want to understand a little bit more background for his question. Yeah.
Okay, well, William, if you're hearing this, feel free to post a little more in the chat on your question. Jen Ball asks, do you have assisters that can help people in Spanish or Hmong? It sounds like you do.
Yeah, absolutely. It's a great question. So yes, we have assisters throughout our network who can help with Spanish speaking populations as well as Hmong speaking populations. And you should also understand that any language we can assist with, even if we don't on our staff have somebody who speaks that language or in our network who speaks that language, we definitely utilize resources of many kinds to make sure that we can get the translation support needed.
Great, thank you for that. So do doctors' offices promote your services, or what is your main component for people to find out about this program?
Yeah, a lot of work is our main component for having people learn about it, is trying to be out and about as much as possible through that outreach, through working with all of the different agencies in the state, including health systems, health plans, provider networks. We also do quite a bit of promotion, TV and radio, especially around open enrollment period, to get that broad public awareness. I would encourage all of you, to help spread the word as well. It's an ongoing effort. And like I mentioned, when you have people who are perhaps never been in need of looking for coverage, and then suddenly are, it's only then at that moment that they need to be aware of it. And so that's why we need to continually to work to just raise that awareness.
In our family, we have a lot of graduate students, so college students moving into graduate school. They get out of graduate school, don't have a job right away, and they're over 26, so they can't be on mom and dad's insurance. So in my family, that's kind of what we're dealing with.
Yes.
So I think everybody can certainly be impacted. So we did post all of the contact information in the chat with the phone numbers and the web address. So thanks again, Allison, for sharing this great program with us. And we will do our best at Badger Talks to promote it to everyone around the state with the great talk you've given here. So thanks so much for joining us today.
Wonderful. Thank you so much for having me. I really enjoyed it.
Great. Well, Badger Talks Live will continue in 2 weeks on Tuesday, April 5th at noon. We're going to be welcoming Jake Dean and Greg DeCroy with the Granger Center for Supply Chain Management, something we're all experiencing right now in terms of disruption. So they're going to be talking about what's happening with these supply chain disruptions and what will happen next based on their expertise. So please tune in. Visit us at badgertalks.wisc.edu. You can see the upcoming schedule of talks. You can check out our podcast with Ben Rush. You'll also be able to sign up for our email list so you can get firsthand notices about upcoming Badger Talks live events. Please consider a donation to Badger Talks Live. We are grant funded, and we have about 400 UW faculty and staff that are signed up on our website, where you can search by keyword to find them. If you have a particular topic that's of importance to you that you'd like to bring to your community or neighborhood, and they will come to your neighborhood or present virtually through Badger Talks. So please check it out. Look forward to seeing you again in 2 weeks, and thanks so much for tuning in.